Good evening. It's Wednesday, August 4th, 2021 at 6 p.m. Calling the Lakeville Board of Health meeting to order. Is there anyone recording this other than LakeCAM and the Lakeville Board of Health? I see no one for the record. First on the agenda, 141 Rhode Island Road, new boarding stable permit. I'll turn it over to Ed for an update on the permit, where we stand.
Yeah, so the animal inspector was out there, everything looked okay. If you want to come up and speak for you, I'll feel free. The application, everything checked out okay. If they'd like to say anything else to the board, but everything's in order at this point.
Okay, and there were 11 butters notified?
Correct, and we got all the green cards.
Green cards, okay. And you're asking for 8 horses?
Correct.
Okay. I don't think I had any other questions on it. So the inspection's all set
Yep,
and the barn's already up, stable?
well, for the 4.
Yeah, so we have stalls for 4 right now, and areas where we've identified to add more barns, but that would be down the road. So 4 to start, but just asking to have the capacity to have 8 since that's what the land supports based on the stable regulations.
Okay, with the 8 acres, yes. Yes, and in your application, you have everything pretty much listed of the size and everything on it. It's very, do you have any questions on it?
No, to get in the butter. I just want to see if he has any questions.
I have none.
Oh,
What number a butter are you?
3 Southbourne.
Okay.
yeah, they meet all the regs. They're not asking for a variance, so it's a.
Yeah, they meet everything, and there's no one here to voice any opinion on it, so we should be good on it.
Yeah.
And Chris Pratt is obviously not here, not present tonight, so there's just 2 of us. You wanna make a motion?
I'm good. I'll make a motion. We approve the new boarding stable permit for 8 houses, 8 horses, 4 now, and the other 4 after we do an inspection to see when they're all built and you're ready for them at 141 Rhode Island Road.
I second that. Any discussion? All those in favor?
Aye.
Well, that was
That easy? Yeah?
Yeah.
Thank
Yeah, with
you.
no butters?
When people
everybody-
ask for variances, then sometimes, and then if the neighbors come, but
Yeah.
you didn't ask for more than you're allowed, so
No,
yours
I'm
was
not
easy.
Has
trying to
every
be
right.
greedy, just
Yeah.
Yeah,
do what we moved to Lakeville to be able to do.
Yeah.
That's all.
good luck.
Thank you so much.
Thank you.
Good luck,
Appreciate
guys.
your time.
No problem. Next on the agenda, 26 Johnson Drive. Meet with Outback Engineering to discuss local upgrade requests. Jason Youngquist from Outback Engineering called me and asked him to open this, but to continue it to the next meeting because he was unable to meet with us tonight.
Okay, I'll make a motion, we continue 26 Johnson Drive until our next meeting in 2 weeks.
Second, any discussion? All those in favor?
Aye.
Aye. Next on the agenda, 4 Devon Drive, meet with Foresight Engineering to discuss local upgrade requests. Again, on this one, Darren Michaelis from Foresight Engineering called me and asked to be continued, open it, and be continued to the next meeting. I believe he was gonna put a new system in with the tanks. Am I correct on that, Ed?
Yeah, so the tanks is what the waiver is asking for, but we just did the perk probably about a week and a half ago.
Okay.
And it was a sieve analysis, so it's very possible he didn't get the sieve analysis back yet, and then he needs to do the design for the field from there, so probably just not ready.
Okay, and I think he said he'd have a new plan in for the next meeting showing the new field.
Exactly, yeah. So we just probably need a little more time.
Okay,
That was expected.
all right.
All right, I'll make a motion, we continue 4 Devon Drive into our next meeting in 2 weeks.
Second that. Any discussion? All those in favor?
Aye.
Next on the agenda, betterment approval, 199 Rhode Island Road in the amount of $28,113. Ed, everything, I didn't see anything.
Yep, everything's in order there.
Yeah.
All the paperwork's in, and it's just a matter of approving it.
Okay.
Okay. I'll make a motion, we approve the betterment for 199 Rhode Island Road in the amount of $28,113.
Second, any discussion? All those in favor?
Aye.
All right, now we'll move down to review and approve meeting minutes as typed. Board of Health meeting minutes, March 3rd, 2021. All three members were present at that meeting.
Were there only minutes? Should we wait for Chris to make sure he's good with them, or?
They're all the way back to March, but we can.
Okay, no, I mean, I don't mind, I just didn't know if
They're getting pretty far.
he was here
It's
for them,
August.
so. Yeah, all right then.
I don't see. It
No,
is
I
the
was
old
good with 'em.
powerhouse one.
Huh?
I read through them, I didn't.
Yeah. No, I did too, I just didn't know if maybe Chris had any comments, but, because he was here.
I mean.
No,
if
let's
you
just
want-
do them, if he had them, if he had any comments or questions, he would have told Ed, so,
Yeah, he normally
He
gets
didn't make
back
any
to you.
comments.
yeah. All right, then let's do it.
Okay,
I'm good with all three of you.
I'm good with all three.
All right, I think we
We'll
can
do
only do
one
one
at a
at a time
time,
though,
we can.
so. I'll make a motion, we approve the March 3rd, 2021 minutes as typed.
Second, any discussion? All those in favor?
Aye.
Aye.
I'll make
Next.
a motion, we approve the March 17th, 2021 minutes as typed.
Second, any discussion? All those in favor?
Aye. I'll make a motion, we approve the April 7th minutes as typed in 2021.
Second, any discussion? All those in favor?
Aye.
Aye. Got those all approved. I'll be catching back up. Next on the agenda, we'll go down to old business, discuss recent Board of Health agent pending items. Turn it over to Ed if anything you want to.
So on our tight tank inspections, we have 18 people that did not do the tight tanks yet. And we're sending out another letter saying, okay, do it, but
Yeah.
if you guys wanted to set a deadline, or how did you guys want to do that as to when they had to have
Is it the
done?
first reminder or the second, or how long have you been telling them?
This would be the second reminder.
Okay,
And this had to be done by May 31st?
Yeah, it's supposed to be done in the spring.
April, yeah.
okay.
So, it's still,
Yeah, I guess we gotta give them a deadline then, right?
yeah, give them before winter. I mean, give them, I mean, it is COVID, but it's still, I don't think.
They
that's
can
ever
do
an issue.
inspections during COVID.
Yeah, I mean, it's, I don't think that's holding up anything to do
No,
with
I
inspections,
mean,
it's
and,
just, they just don't wanna do it.
Yeah, I mean, it's available, like I said, everyone's, all the Title V inspectors are out and doing their work. They're busy, but, you know, they're available.
And the state has no more restrictions with extending permits or anything like that, that's all been lifted fully, right? It's nothing that,
Yeah,
okay.
so what do you
Yeah, I
wanna
mean,
give them? Did you already send out that letter, or is this
No,
gonna be the
we're-
second letter?
We're waiting for your feedback before we send out the second one.
So it's August, by the time it gets out, it'll be the middle of August. Then to call somebody, so wanna say the end of September? Give them 6 weeks?
By October 1st or something?
Yeah. All right, send out by October 1st, it needs to get done.
Okay?
I don't think we get a vote on a date.
No, I don't believe we
No.
can vote on that.
You get anything else, Ed?
No, that's it.
All right, I'm just gonna bring up something that didn't make it in time to get on our meeting. We had a complaint. I'm only bringing it up because I wanna make a motion to allow, Derek, give him the authority to work with, the Director of Inspectional Services, who is Nate Dowling, to do investigation on it, and then be able to bring it back to us if necessary at our next meeting.
Okay. For two of us, it would still, I can.
Yeah, we can
just
do it,
vote
yeah. We're just voting to give the chair the authority to do it, so we
To
can do
me,
it.
and
Yeah,
then report to the board.
yeah, we're not letting you vote or do
on
anything,
the
we're just
complaint
saying,
and the
yeah, validity of it,
validity of the complaint.
yeah.
Okay,
So you wanna second it?
I second.
All right.
Discussion, all those in favor?
Aye.
Aye. Okay. I don't have anything to bring to the board.
Wanna talk about, COVID in Tripoli?
Yeah, I'll give it over to Ed.
Yeah, so Triple E is still There hasn't really been any cases yet, so that's good news. They are doing surveillance, but as we were saying earlier, the mosquitoes are coming out now. They're really, the numbers are there, so it's possible that we could get one very soon because, like I said, there was a dry spring which delayed the number of mosquitoes, but since the beginning of July, we've got a lot of rain, and that's really just multiplied the number of mosquitoes out there. So obviously, the more mosquitoes out there, the more chance of triple E's out there. But so far, so good. No human cases of triple E.
Okay.
For COVID, many people have heard the Delta variant is taking hold in Massachusetts, especially in the last week. We probably hit the low at the beginning of July, and since then it's been increasing rapidly. Both I think hospitalizations are 3 times what they were 3 weeks ago.
Yeah.
They have tripled. The number of cases have the same thing, doubled and tripled. Everything is just going up. I think Lakeville had just had three more cases just today. So cases everywhere. Also, what they're seeing is a lot of younger people being affected by this new Delta variant. Some even kids. More so in the states down south where it's really exploding. Massachusetts has a much better vaccination rates than a lot of states. So although it's increasing, it's not the level it is in a lot of other states. But when you get that rapid expansion and you have a lot of unvaccinated people out there, they're finding that the cases, especially young people and kids, is a lot more common. It's not unusual. Before it was like mostly over 65s in the ICU. Now you're seeing 40 and 50-year-olds in ICU. And I said some states even have children in the ICU. And I just heard 2 kids in Tennessee just died.
Oh, yeah.
So it's a different variant. It kills you faster, so you have a lot more virus. And they're saying even the vaccinated can spread it. So a lot of precautions. And the CDC is recommending mask use, even for vaccinated in indoor public places that are crowded. So just keep an eye on there. Like I said, we did a good job keeping this down, but we can't really let up our guard now because, like I said, we're at a point right now where the cases are going up, and if we don't do much about it, it could get bad like those other states. So please take precautions that you did last winter. If you can still please take those precautions, it'll help out a lot.
Well, I was watching a show and they said that this Delta is so contagious that if you're not vaccinated, it's not if you're going to catch corona now, it's when you're going to catch it.
Yeah.
Because they don't think it's going to let anybody fly under the radar this time. It's so contagious.
Yeah. And like I said, it's exploding in some states because of low vaccination rates, but it's increasing rapidly in Massachusetts, but it's not exploding. But the thing is, although it's not exploding, it will last for a while. So we'll get an increase, and it'll be a steady increase over several months. So like I said, it's not going to be, 2 or 3 weeks of increasing cases, then it's going to drop off. I mean, there's over 2 million people in Massachusetts who are unvaccinated right now. So it has a lot of people to go through. And like you said, it will find them. Because like I said, in the previous winter, we took a lot of precautions. And there were a lot of cases, but we took a lot of precautions and limited the number of cases. Now we don't have those precautions. And you're dealing with a variant that's twice as transmittable. So the combination, something twice as transmittable, and we're taking fewer precautions, it's exactly what you said. It's going to find you. So if you're unvaccinated, most likely you will get the Delta variant.
So
Just when you think.
good reason to get the vaccination.
Yeah.
If
And you can win $1 million.
Yeah. I'm in that lottery. I didn't care. Did you sign up?
Yep.
I signed up.
Yeah, I signed up.
Somebody's going to win it.
There's 5
Yeah.
giveaways. So one person already won it. There are 4 more giveaways. So like I said, if you haven't got vaccinated yet, sign up to get vaccinated and register, and you can win $1 million.
But it's nice to see though. I think I've seen 2 different networks use Massachusetts as an example as the best state, and then they compare it to other states, the worst states, to show the comparison. So Massachusetts really did a good job, but we still got a ways to go. So
Right. So they say about 74% of Massachusetts adults are vaccinated, which is good. But like I said, we really would like to get up to around 80% or something like that to really be covered.
Okay.
All right. I'm just gonna bring up one more thing we did have a complaint from the Lakeville Country Club about a water issue. Not having water to the board, not to the board, but to the Board of Health, anonymous complaint that they didn't have water.
That wasn't on the agenda though.
No,
And
I'm just bringing it up just
I
to
told the owner that
discuss.
it wasn't gonna be discussed tonight though, because we didn't put it on the agenda.
Okay.
It's your call if you want to, but
I
I
don't want to, I was
specifically
just
told
bringing it
them.
up to you as the board member,
Oh.
just so Ed and
Yeah.
I are addressing it, and other than that, I'll just
Okay.
forward you any emails on it.
That's
But we're
fine.
just looking into it, just so it was brought to our attention. So the Board of Health's looking into it, and we'll
Okay.
discuss if there's anything further on it. I think that's all I have. Anything else, Ed?
No, that's all.
I'm good. I'll make a motion to adjourn.
Second? All in favor?
Aye.
Aye.